Welcome to That's Derm Good. I'm Janelle Ball, and I'm excited to bring you thought-provoking conversations about biologics, specialty medications, treatments, and so much more. I'll be chatting with some amazing guests about access, affordability, and advocacy. You're really going to enjoy this show. Welcome to That's Derm Good. Today, my guest is Toni Sikkema. Toni is the founder and CEO of Solutions Maven Consulting. Welcome, Toni. Thank you for joining That's Derm Good.
Thank you for having me. I'm excited to do this today.
Yes. So before we get into all the derm stuff, operations and everything, I want to start with you grew up in or near Yellowstone. What was that like? And do you have any wild childhood stories for me?
Great question. I get asked this a lot. So, moved around a lot as a kid with my parents and ended up, long story short, we were living in Texas and my mom actually worked in the hospital system. She was a surgery tech for many years. Got tired of the number of people where we lived. We lived in the Dallas area. And she took a trip up to Bozeman, Montana for a job opportunity and drove through a small town called Cody, Wyoming. And so my parents liked Cody so much that my mom decided not to take the job in Bozeman and applied for a job in Cody. So that's how we ended up there. I'm just very random. Cody is just outside of it's the east entrance to Yellowstone National Park. So it's very there's a lot of tourism is the majority of businesses and how they make a living in that area, especially during the summer months. What was it like growing up in Wyoming? It's beautiful. I feel very fortunate that I had the childhood growing up that I did. Uh, I grew up in a very safe kind of bubble, I would like to call it. But then I had opportunities for both college and kind of seeking other career opportunity as well in the area. So I go back every 2 years. My family still lives there. And so I visit often. So
Yeah, that's
it's
nice.
nice.
I always wanted to do like a road trip out that way, and I have never made that side of the country yet.
There's a lot to see.
Yeah. Yeah, that's cool. So, but then you moved to Florida.
Did. So fast forward, I actually moved around a lot. I moved to Colorado and back to Wyoming, and then I moved to Montana and ended up back in Wyoming. And then, long story short, I made the trek to Florida. This is my 7th year living in Florida.
Okay.
So, kind of picked everything up and took a leap of faith and moved down to Florida and I was able to get a job within the first 30 days of living down here. So I was very fortunate. Right before COVID, I moved here in the summer of 2019. And things have just worked out for me. So now I live on the west coast of Florida and I go to the beach often. I like living down here.
Yeah. I was gonna say weather-wise, probably completely different.
Yes. After living in Wyoming and in that area and shoveling snow for many, many years, I was ready to have warm weather. The summer is a little brutal, but you get used to it like you do anywhere else.
Yeah. Is it dry heat in Wyoming?
Yeah, it's more like Cody's kind of more like an arid desert, I would
Okay.
say, type of environment.
Mhm.
Some winters they get a lot of snow, some they don't. It does get very, very cold though. So even when they don't get snow, they get like bitter cold temperatures in January and February each year.
Yeah, living in Ohio, it's definitely tempting. I've got some family in Florida and some in North Carolina, and they're like, "Just move down this way." I'm like, "I'm considering it, but."
Yeah, I would say that I'd be open to moving to other places, but I'm definitely not gonna leave the Southeast. I've
Yeah,
established that after living up north. I'm gonna stay Georgia, the Carolinas is okay, but the Southeast area is basically where I'm gonna probably end up for the rest of my life. So
yeah.
no more snow.
So, what pulled you into dermatology specifically? I know, like, your mom was in the healthcare space. Did that always inspire you to say, "I wanna be in healthcare," or "I wanna do something in healthcare?"
Yeah, that's a good question too. When my mom was a surgery tech, my dad also traveled for work and was on the road for several weeks at a time. And so my mom was on call a lot. I spent a lot of time in the OR lounge, right? When my mom would get called in when my dad was gone. And back then, when I was that young, I used to say, I never want to work in healthcare because I was very much experiencing that as a small child. But then as I had grown older and kind of thinking about what I want to do for a career path, I actually applied for a position for an assistant to the director of nursing in a small hospital in Cody. And the director of nursing that I work with, I always praise her because she's really the reason why I decided to go into healthcare management. And that was a really good experience for me. It's very eye opening. And I got a good kind of rounded experience and kind of understanding of hospitals and a good start to healthcare. So after working with her for several years, then I decided to go back and finish my 4-year college degree. And that kind of started my whole healthcare management career. So fast forward, I started, after college, I kind of worked in patient access. I worked in orthopedics. I worked in internal med. I worked in a specialty clinic that had internal med, rheumatology, cardiology. I assisted when an oral surgery office. That was a new office that had opened. And then I also worked in a VA clinic. So I worked for a company that managed and started community based outpatient clinics for the VA. So I really got a good experience of kind of working in several different areas. And actually, I got into dermatology when I moved to Florida. So that was the job that I got when I first moved down here, and I loved it. So I got to work with a really great practice owner. I got experience with expanding into another location and learning everything about derm. I had always known that I wanted to do consulting. That was kind of the long term, the long game for me. And after getting enough experience, I was ready to start and go out and do consulting on my own. So I just stuck with dermatology because I love it. I learned a lot about it. Uh, and dermatology is busy, it keeps me busy.
It is
Yeah.
busy. That's that's awesome that you had so much experience in multiple different specialties and settings too. Like the difference between the hospital setting versus private practice. What are some of the biggest things that you've seen that are completely different? But then what is like maybe the one or two things that you see everywhere?
Great question. I would say the big difference that's between private practice and a hospital setting would be compliance. So compliance is really I mean, it's required whether you're an independent practice or hospital, but hospital systems have significantly more compliance that you have to follow because, you've got surgeries and all kinds of fun stuff going on in the hospital environment. I would also say that the pay structure is a little different as well. The biggest challenge I see with small practices is when you go to hire somebody who's used to working in a hospital environment, they're very much used to a higher salary range, kind of a little more perks, right? Like their PTO balances never roll over, and like there's, a lot of caps that don't exist. I would say across the board, what is very similar in hospital environment and private practice, staffing challenges. They're no different from hospital to private practice. And making sure that you're hiring the right people. It's the same people issues, right? It's still got to make sure you have trying to develop the right culture, not tolerating bad behavior, low performers, things like that. So those are very similar regardless of how you're delivering your healthcare or what avenue or what facility you're in.
Yeah, it's crazy, but I feel like it's across the board, some of those issues that we see in healthcare, they're having the same things in the restaurant business and retail, and like all of those things. And it's really unfortunate, but what would you think one thing that would really help with a lot of that? Do you think it's a lack of education?
I think there's a little bit of fear that goes into this when it comes to, I think, just overall in managing people. I think there's fear of conflict. you can have healthy conflict and still be respectful and communicate, what needs to be communicated to maybe the employee that you're having issues with. It doesn't have to be chaotic and very dramatic fields, right? It can be very just kind of straight to the point. And I think there's also fear too of, if I let this person go, now I'm short staffed, right? Or there's a lot of issues around that. And then you have pressure from maybe other providers in your practice, right? Like maybe there's an MA that you need to let go, or maybe there's another physician or a PA or a nurse practitioner that you have to address. And it's a lot of, well, what am I going to do with who's going to see these patients? And now I have to fill this position. And so it's very much like there's a lot of work and there's a lot of extra stuff that comes with it. But I would say in the long run, not addressing the bad behavior or the person who's consistently kind of maybe stirring the pot has longer effects, because now what's going to happen is if you bring in new talent and they're like, well, I'm not going to tolerate this kind of behavior, you won't be able to keep good people. And if it then starts to kind of bleed over into, say, patient care, like, for example, if you have a patient or patients who have complained about a provider in your practice or an employee or your front desk person, right? You can't keep that in your practice, because then patients are like, well, I don't want to go there. That person's rude, right?
Right.
Or I don't feel heard or want to, things like that. So
Yeah. It
it's
has
a tough conversation.
it has a trickle down effect too, it's like one person starts to get away with it and then everybody else thinks that they can too, and, it just continues from there until somebody puts a stop to it.
Yeah,
Yeah.
I think too, it's like, if you have say you have maybe a provider in the practice and maybe they're complaining or they're unhappy about something and they're doing that complaining in front of the staff, like the clinical staff, everybody's going to jump on board. It's so easy to be negative, right? So it's really kind of, developing and setting the expectation with your team like, hey, you may not be the manager, but you're definitely seen as a leader. And so you need to, kind of act accordingly, right? They still look up to you, and they look to you for certain things.
Mhm.
And so if you're acting in that manner, they're going to think it's fine too.
Right.
So,
Yeah. Yeah, I was at a conference not too long ago, and, one of the things that the there was a question that came up and was talking about how do you address the different, what would you call it? I guess so you've got, like, your millennials and, like, your Gen Z and, like, the different stages of life that people are in
mhm.
and how culture affects their work ethic. It's wild to me because I seen growing up, I'm like, okay, you work hard, you work and you put your best foot forward, even if you don't own the company, when you're working a job, you should be working like that is your company. And that's always been, how I've done things. And it's really wild because, you do hire people and they don't care. And they're like, it's just a job, it's just gonna pay my bills. And there's no, I guess there's like a lack of being able to own it, to own, like, their responsibility, and, and that can be so frustrating, and I feel like we see that so often now.
Yeah, definitely a lack of accountability, right? And there are people out there that literally just want to come to work and punch the clock and go home, and I can understand that. I can understand that from being in an environment where maybe you're in an environment that that you're not able to contribute to, or nobody cares about your opinions, or they don't want your feedback, and like, so I can see where that comes from. Definitely trying to manage different generations is challenging, and totally agree with you. I'm from that generation. It was, really strong work ethic, getting your stuff done. Like, in my previous years of working in clinic, it's like I'm doing work from home on the evenings and the weekends, and it's just like, and I'm not on the clock, right? I'm a salaried employee, so I'm just kind of making sure I get things done. And I would say that, the younger generation now, I will say that they have a lot of boundaries, which I guess is good, because in our generation, we don't have very good boundaries when it comes to that, right? Like we have a really hard time saying no. But there's got to be a balance of that, right? And I definitely think that, kind of, especially after working in the corporate world too, right? The expectation is much higher with the volume of work. And so, and then you have the older generations, right? And they're, you know, that generation's kind of not as flexible, but they'll work, right? They're like, "Oh, if you wanna pick up an extra shift or can you work overtime?" And they're very willing, but sometimes they're a little more stuck in their ways, right? Change is very challenging for them. I think change is challenging for everybody, but I would say that each generation handles it very differently.
Yeah.
I agree. I don't have it all figured out when it comes to kind of managing. I think it's they each have different motivators. And I think trying to determine what motivates your team the most
Mhm.
and trying to come up with a good balance of what works and what doesn't.
Yeah.
That's the beauty about private practice is you can do a lot of trial and error until you find something that sticks.
Yeah. I like that. I like how you said that each like people have a different motivator. And that makes sense because you obviously everybody has their different style of working and, managing, but and that things can work differently based on how you react to the staff and what that culture looks like and how you've built that culture, and I love this piece of the medical office because I'm excited about, how can we help these practices get better at what they do. And because everybody there's competition. Everybody's trying to be the best office so that patients continue to come back to their office and to make a big impact on the community. And I think one of the best ways that an office can do that is by creating an amazing culture for their staff to want to work in and to want to be happy to some of those employees that may not be motivated to go beyond feel like they can in a place that they thrive in, that they enjoy working in, and that's kind of what helps to motivate and build that kind of culture as well.
Yeah. Yeah, it's challenging, but some days it can be difficult. Some it's definitely a challenge though of kind of gauging how to manage your team depending on their age group. So,
Yeah. So tell me a little bit about Solutions Maven Consulting. What exactly do you do? What made you decide to start your own consulting company, and what all does your consulting company entail?
so after working in healthcare management, for an extended period of time, and kind of working and being in the environment and working in several areas of medicine, the one thing I found really challenging was the need for a really strong practice manager, director of operations, somebody that the point person that kind of keeps it all together. And so I kind of identified a niche and where I was like, okay, this is really challenging sometimes to find the right person. And I think there's a lot of factors that go into that. I think it's just lack of education. I think it's lack of education and knowledge. I think it is oftentimes I will hear and see, well, I'm going to hire my sister in law to be my practice manager. This is probably not going to go very well if you have to have some difficult conversations, right? Or someone who doesn't have any background or experience kind of working in any kind of management role. I would say that, healthcare in this industry, it's helpful to have somebody with that background, but the key is somebody who knows how to manage people. And so that's really the skill that you're looking for. So kind of after doing that, I had gotten to the point where I'd worked with a few practices and I was like, I want to do this and I want to help multiple practices. So solutions maven consultant, consulting, excuse me. I launched this business. I do interim practice management, where if a practice has a practice manager who has left, either they're transitioning out or it was somebody abruptly leaving, somebody where you can come in and kind of fill that void. There's a lot of administrative tasks and things that need to be managed while you're looking for another practice manager. I also have identified that there's not a single practice manager, director of operations There's not one person out there, regardless of how big or small their practice is, that can do it all because there are so many things that go into running a medical practice. And so part of what I do a lot of supporting of practice managers in their practices. My job is not I'm not trying to take their job, I'm trying to help them in their job. So I also have identified helping with some coaching and, like, giving some suggestions and resources, and I have time capacity because 'cause I'm not in the clinic itself. So I have the ability to kinda work on bigger projects for the practice and things like that. I do practice assessments. So oftentimes, by the time a client reaches out to me, they're really frustrated. They're either having a lot of challenges with people, their practice manager. They're not quite sure how they're doing financially. They're not quite sure if their staff are trained or even am I using my EMR system to its full capacity. So I do practice assessments. I come on site. I spend an entire week with the team. I talk to everybody. I talk to all the physicians. There's nobody I don't speak to while I'm there and kind of do a dive into everything, their HR, their policies, their payroll, what are their costs, and kind of give a full assessment and an action plan of here's some things that I see, and here's some recommendations on how to fix these things, and then here's an actionable plan of to try to keep you on track of getting those things in place or getting them corrected. And either the practice decides that they want me to help do all that list, or I'm just here to kind of support their practice manager or their management team to kind of get them there. So I'm kind of the keeping them accountable, right, of getting those things done. I have a small team that works with me, so I do have a couple of dermatology specific billers who help with practices that are either they need to get caught up with their AR, or they have a lot of, maybe if it's a practice that uses ModMed, like their staff don't have time to manage all the patient bills on the back end and allocate payments and things like that. And then just recently, we also launched some credentialing as well. I get asked a lot about credentialing. So we have a team member who assists with that as well. I'm trying to just be a little more well rounded to kind of help with a lot of the things, anything around practice management. And then my favorite thing that I do a lot of practice startups. So I work with a lot of physicians who have decided that they want to be their own boss. They want to be an entrepreneur. And so I work with them from start to finish. I'm launching a practice, and it's everything from getting them set up with all the resources and vendors, a real estate agent, an accountant, an attorney, and then all of the logistics like selecting a billing company if you want to outsource it, an EMR system, all the way up to opening day. I assist them during that process. And then I also assist post opening as well. Again, kind of like on an interim basis. They're not quite ready to hire a full time practice manager just yet. And so I kind of help with some of that. I help with hiring, posting jobs, and screening candidates, and scheduling in person interviews and things like that. So kind of a well-rounded,
Yeah.
service for the most part. I also do project-based, needs as well. Like, I'm familiar with how to set up a Mohs lab and what you need for your CLIA manuals and things like that.
Yeah. So all the little details that come with starting a practice or building a practice.
That's my favorite thing to do because it's gratifying for both myself and my client. Because
Uh-huh.
at the week that they are open, this new office, they have staff, they have patients on their schedule, and so they're really, everybody, comes all for full comes all full circle when they get ready to see their own patients. So it's great.
Yeah. So what about the offices that are growing, like, that have gotten growth? Do you go in and, I know you said that you do an assessment. If they are trying to figure out, okay, do I need to hire somebody else for this other position? Or, because you have some practices that are small and you've got one person that is doing all of that. How do you approach, like, hey, you need to scale. You need to start,
Mhm.
delegating these things. Do you help them kind of figure all of those things out? Because I feel like that part is difficult.
Yes. Yes, it can be. I totally agree. I think there's several factors to that. It's like, okay, so the first thing is like, what's the utilization of your schedule? Like, how full are you? And if you were to scale, how much growth is available there for you to say you decide that you want to bring on a PA, right, in your small practice, and you're okay, and I have a full schedule. I see, upwards of 30 patients a day. When do I hire? When do I bring on another PA, right, to join the practice. So I think looking at your utilization, also think about, you have to kind of, there's some contract negotiations, like how am I going to pay this person, right? Like, am I going to, do I want to kind of grow my own? Do I want to train a PA, right? That has never worked in dermatology before? Or do I want to bring in somebody experienced? How far booked out am I? If you're in a practice and you're 3 months booked out, 1000% you should hire somebody. Or you have a location and you've already reached your capacity, right? Like your space capacity. That's the other thing is how can you utilize your space, right? Do you have an office that gets used like 1 day a week? Let's turn it into an exam room so it can start generating revenue for your practice. And so I think all of those things are kind of looked at before you decide whether or not you want to bring on another provider with your practice or you're in a position to open another location. And a new location too, there's a lot, it's kind of like a practice startup, right? You have to like, well, where's the best place to put this at, right? Like, what are the demographics? Does the population support that? What other competition may be in that area, right? For me to open another location. Dermatology is a very, sought out, specialty, when it comes to patient care because everybody needs dermatology,
Mhm.
and depending on where you live at. So, that their access to care may be a little more limited. Like, for example, I have clients that are up in the Midwest, and they're killing it because they don't have a dermatologist for hours, right? They don't have a dermatologist for an hour and a half, so away. And so that's an easy decision to make, when it comes to opening in a location like that. I will say though, it still takes time, right? So anytime that you decide to add on somebody or you add on another location, it's not going to be instant. Regardless, even if it's a practice startup or an established practice, it takes time to build up those schedules to get them to full capacity as well.
Yeah. Yeah. Even like what about the staffing and the hiring side of things as
Yeah,
well?
that's the other thing too. So, right, you can't hire another physician if you're having a hard time just staffing what you have right now, right? I think there's a lot of other things and alternatives out there. Some of them are popular, some of them work well, some of them don't. I think it depends on where your practice location is, but hiring virtual assistants has become very popular. And the reason being is because they're lower cost, they're available for your time zone, and they can offload a lot of administrative duties that say your front desk are having to take on, or, prior auths and managing faxes and even answering the phone like a call center that alleviates a lot of kind of the in-person need in your practice, depending on the size and what your volumes are. We hear about AI scribe that's becoming more and more popular too with EMR systems, right?
Mm. Does that
There's
make
still a
you
little.
nervous at all?
I think that it's still going to require oversight. So even though, you kind of have to AI, the term is you have to train it, right? So you have to train it to kind of learn how you document and things like that. It's still going to definitely require physician and provider oversight, right? Because at the end of the day, you're signing off on your notes, right? So you wanna make
Right.
sure that it's generating those things. I don't think AI is ever gonna really replace a real person. I do think that it may cut down some time, but I also don't think it's still quite to where it can replace an entire person, right? So for an example, you still need an MA in the room to do procedures with, right, to assist. It just may speed up the process, right, where had the ability to do less of the documenting in the EMR and they're able to kind of switch back and forth more quickly. I wouldn't say that it scares me. I think that it can be a useful tool, but I definitely don't think that it can replace everything.
Yeah, I agree.
it's still like, like if you look at AI images, they're distorted, right? Like if you're paying attention, like we can all now start to see what's AI and what isn't.
Mhm.
And so now we're like, well, is that real or is it not? Right. So I still think it has a ways to go. I think it's definitely helpful
Yeah.
in healthcare. So
Yeah, absolutely. I agree with that 100%. I think, you know, it there's a lot of people that are just, like, not trying to embrace it at all.
Mhm.
But it's not going anywhere, and we either need to learn how to work with it and utilize it the right way versus, you know, I think when it first came around, everybody started seeing more and more AI, they were intimidated because they thought, "Okay, this is just gonna replace me." And, you see the robots and all of that, and, like,
Mhm.
it's not quite there yet, but the best way that we can use it is as a tool, what it is, and not thinking for us. And I think that's one of the difficulties that I think a lot of people are thinking like, "Oh, it's just gonna do everything for me." No, we use it as a tool, as a resource to automate things and make things a little bit easier, but we're still in control. We're still have to use our brain and our,
Right. Right.
problem-solving skills and all of those things and those ideas,
Sure.
and, it can help us to create something even better, but yeah, it's
A lot of things, like if you think about it, AI is just searching the internet, right? So like there's a lot of crazy stuff on the internet. So it's kind of it's regurgitating some things that are not necessarily true, right? Some of it has part truth, part not, but it's also not going to be able to give you like, I think it's a super helpful tool of like, here's some steps of how to do something, right? Or scanning maybe like a referral and spitting it out into like the patient chart or something like that,
Mhm.
right? But it's still not perfect.
Right.
But yeah, I still think there's it has error because it doesn't think. It's just
Mhm.
grabbing information that's already out there,
Yeah.
whether it's true or not. I mean, if you can see those little warnings that says, like, when you log in, like, when you're trying to search for something or ask it to create something, it'll say, "Please check this may not be factual."
Mhm.
So things like that
Yeah.
to consider. And it also is not gonna give you, like I'm thinking from, like, a consulting standpoint, it's not gonna tell you, like, best practices, right? Like, it's gonna give you 800 ways to do something, and that's great, but it's not gonna, like, here are some pros and cons necessarily, and this is what may or may not happen or things like that. So, um
Yeah. It sounds like a lot of what you're doing is looking for some of the inefficiencies within the workflow, within the process in the practice. Help them kinda streamline things and make things a lot easier.
Yeah. Workflows to, what are your processes in place? What are some ways to kind of be more efficient? And then what are some ways to increase your collections, right?
Mhm.
Like, are we collecting copays consistently? Are we collecting deductibles? Like, I would say that's probably the biggest challenge in private practice is, you're not a hospital, right? And you don't have this huge insurance team, that's going to make sure that you're collecting every penny on every dollar, right? It really comes down to a lot of education and understanding, right? Like we need to make sure we're doing these things consistently so we can keep our doors open, right? Like we can't solely rely on insurance either.
Yeah.
So definitely I'm definitely pro advocate for physicians in running their own practices. So I'm very passionate about what are some ways to help you run your practice better. So,
I think that that is a big issue that you're seeing in a lot of practices is with, like, collecting money so that they can, that they're not missing things and things aren't falling through the cracks, and that's how a lot of office issues.
from time to time, you either have staff who are they're anti-conflict. So if they ask a patient for a copay and the patient can be aggressive or be like, no, I'm not paying that, or no, this isn't due, or why do I owe this? They kind of are like, I don't really know how to answer this question. And I don't want the patient to get upset with me. So I think it's a lot of education on the insurance plans, how to ask for money from a patient, and also setting the expectation that when you come in, that this is due at the time of your service. So I think it's all those parts. And then I think the fourth one too is lack of education on the patient's side as well. When they purchase these insurance policies, they're not given a very good education as to how this works. And it's an HMO. What do you mean I have to get a referral? I don't know what that means. What am I supposed to do? What do you mean I have a high deductible? My insurance plan is affordable, probably because you have a high deductible, unfortunately. You know what I mean? So I think it's a lack of that on their part. And so I feel like the practices also have to spend a lot of time explaining that to the patient, right? The patient automatically correlates where you take my insurance, so you need to figure it out for me. And it's like, unfortunately, you pay for this policy, right? This is your policy that you opted in for. We're contracted for this certain amount, which is what we collect. And then the rest is your responsibility. And so it's a lot of, trying to educate patients, I think is probably the biggest challenge in regards to that.
Mhm.
Needless going back to kind of collecting money, some practices do really well with it. I think the demographic, the age group of patients that you see, I think makes a big difference. For example, here in Florida, patients are they're all Medicare patients. They're used to having secondary insurances and supplementals. Say, for example, if something does drop to patient responsibility, they want a paper statement and they want to write a check and mail it in.
Mhm.
Go to, San Francisco and, everything is, you have a much younger demographic and they're willing, like, they have a credit card on file policy, right? So you're charged right at the time. As soon as it drops patient responsibility, it gets charged to your card. So it's very different on where you live and how you can manage those things. And they all come with kind of different challenges. But collecting money, I think every practice needs education and get
Mhm.
comfortable and train their staff, like, "How do I collect money from this patient?"
Yeah.
Without we don't want it to turn into an argument either, because there are patients who are gonna say, "I'm not gonna pay this," and it's like, "Okay, well, if you're not gonna pay your bill, we're not gonna continue to see you." Right? That's the beauty about private practice as well, like, "Okay, if you're not gonna pay your bill, we're not gonna keep seeing you, so you keep racking up the bill."
Mhm.
I think it's having some firm policies in place too, and everybody understands the policy and that everybody's following the policy.
Yeah. That's true. That's interesting because I never thought about training, like, even front office staff on how to properly collect and, you know, what that might look like. I mean, I worked in front office and I mean, I never had any issues with it, but I think it's interesting that there was never really like, okay, you collect the copay. I mean, that's standard. You would think when you go
Mm,
to a doctor's office, if your card, it
sure.
really will tell you if you've got a copay on there, but somehow there's still, I don't need to pay that copay yet.
Right, and I think that's a great example where that's a difference from, like, a hospital environment to a private practice, right? The hospital are, "Well, okay, that's fine. Well, you'll get a bill in the mail and you can just pay your bill," and in private practice, it's really important that we collect as much as we can up front, right? Because the percentage of your likeliness of collecting from a patient who doesn't pay in the office drops significantly. It's like 30%. So if the patient isn't going to pay, it's really hard to chase them afterwards to try to get them to pay their bill. Some patients are really good though. I think it depends on your demographic of patients. But again, I think it's establishing those policies
Yeah.
and having that up front so that it's very clearly understood it's due at the time of service.
Yeah. So as far as like the office goes, do you have like specific trainings for each department in the office that you do, or you just kind of work with them as a whole?
I work with them as a whole. It depends on the EMR system that they're using as well.
Mm.
I work with a lot of practices who use modernizing medicine with Emma. And just because I worked in Emma when I worked in clinics, so I have a very good understanding and I've done several implementations with it as well. So I have a very good understanding of how the system works, what are some other options, et cetera. But just in general, I do training with, your billing staff and your front desk staff and your clinical staff, right? Just kind of all of it and kind of the workflows within your practice, what are some shortcuts to creating your visit notes, right? Like, from the billing perspective, are you processing claims every day? Are you making sure you're posting payments and applying credits? And so there's a lot of training just kind of all the way around within the clinic that I assist with.
Yeah, that's good. I think one of the things that I feel like we do talk about a lot on this podcast is how important the team is as a whole, whether it's the MAs, the biologic coordinators, the front desk leadership. What makes a derm team truly high performing?
I feel like any team, I don't want it to be specific to derm, but I think in general in healthcare, for them to be high performing is I think that there has to be accountability. Like people cannot be afraid to call each other out like, hey, you didn't run the autoclave last night, or hey, you didn't fold the laundry before you left, or you know what I mean? It has to have that kind of culture. I also think that the team really needs to feel valued, and appreciated. And so I think I'm a big proponent on, making sure, again, wages are wages, right? Like you can't, the sky is not the limit. Unfortunately, there are some limitations to that, but like doing some staff appreciation events. And I'm not talking just like, we joke around about pizza on a Friday, but like every quarter, kind of do some kind of outing outside of your practice that you can engage with your staff that's not work related and treat them, I have one practice that I work with. They use a platform called Recognize. And I really like that because it gives the staff the opportunity to not only do the management team get to recognize the staff get to recognize each other and they actually get rewards from it. So after they get so many recognized points, they can earn paid time off, like extra days off, and they can earn gift cards and all kinds of fun stuff. So I think that's nice to do that. And they do a really good job of kind of doing call outs too when they have their weekly meeting with their team. So I think it's also being accountable, but also like being able to allow them to give feedback like, hey, this is a problem this last week. Can we do something about it?
Mm,
And not letting it turn into a griping session, but like, they've identified an issue. Well, can you help me come up with some solutions? Right? Like, what do you think would help fix that? So I think that's what really drives high performing teams in any medical practice, especially derm. Derm is not stressful in regards to say like you're not working in like an ICU unit, right? But it's definitely stressful due to the volumes and the type of people, the patients that are coming in. One person's coming in for skin cancer and the next person's coming in because they want cosmetics done, which cosmetic patients have their own set of challenges and trying to meet their expectations or set those expectations of what they think of what they're going to look like afterwards, right? And you're going back and forth a lot with throughout the day on your patient's schedules. So it is high stress in regards to there's a lot of work that's involved with it. It's a fast
mhm.
paced environment.
Yeah,
And I think that has to come from the top down, right? I think that the practice owner and the management team have to work together on kind of making sure that they're creating that type of culture within their
right.
practice.
Yeah, that's so true. So
You got to walk the walk.
yeah, exactly. So tell me, looking ahead, what is something that you're excited about moving forward, whether it's within your company or just in the medical field in general? What is something that you're looking forward to?
It's a great question because I feel like I don't know what I'm ready to look forward to because it changes often, right? So
Yeah,
oftentimes I don't know what's coming at us, right? Or kind of what's changing. What does that landscape look like? I'm looking forward to helping more practices in the future. I really enjoy what I do. Obviously, I have to make a living myself, but I really enjoy I have a passion for helping others, and I like to see independent practices thrive. I love working with physician clients who, no shade, but they go work for a PE group, right? And they're like, this is just not what I want it to be. You're capped at your salary. You don't have any autonomy. You spent all this money and training in school for somebody to tell you how you can and you can't treat a patient, right? Or how you can care for someone or hey, this MA isn't working out for me. Can we replace this person? And they're like, no. So I'm very much, I really enjoyed doing what I do. And then also training them on the business side, because not only is it, hey, I have a practice and I'm taking care of people, I also teach them how to run their business. So I think those two things are important. Just gearing up for another successful year ahead. I'm going to AAD next month, or excuse me, this month. It's March already. Can't believe that. So looking forward to connecting and attending some of those sessions. And then I'll also be at ASDS in November this year, too. Those are the two derm conferences that I like to attend. I don't know what it looks like. I would just like to continue to, help practice owners across the country and help them run their business.
Yeah. That's exciting. That's fun. I love that. So
Yeah.
if anyone is interested and, is listening to this podcast, how would they get in contact with you and where can they find more information about your company?
Yeah, I have a website. It's called thesolutionsmaven.com. My phone number is listed there as well, and there's a contact page so you can inquire as well on the website. Or they can email me directly. It's Tony with an I at thesolutionsmaven.com. And yeah, those are two ways, easy ways to get a hold of me. So my direct phone number is listed on the website as well.
Well, thank you so much. Tony, this has
Thank
been
you.
such a really good conversation. I think one of the biggest takeaways here is that, this operations behind the scenes are what really allow dermatology teams to actually deliver really great patient care. And I think it is so important for offices to know that they've got that support there. If, they're struggling saying, okay, I don't, got into this because I'm passionate about supporting patients, but the operation side kind of falls through the cracks sometimes, knowing that there is support that can help you kind of get back to where you need to be and make it even better than before. So thank you so much for sharing your insights with us.
Thank you for having me. It was a pleasure.
Thanks for spending a few minutes with me and listening to That's Derm Good. You can expect new episodes of That's Derm Good every week. The podcast is available on your favorite app, including where you're listening right now. Subscribe to the podcast so you never miss a new episode. Bye.